Good morning, this is YouTube Medical University. Today I'll be explaining in an easy-to-understand way about syphilis, the sexually transmitted infection that is currently at a record high in Japan. Actually, syphilis originally, in the Edo period, syphilis was common in pleasure quarters and adult entertainment districts. With no effective treatments, many notable figures like Toshi Maeda reportedly died from it. However, with the invention of the antibiotic penicillin, which many people might know from the drama Jin, syphilis became a treatable disease. But in recent years, while there used to be only a few hundred cases in Japan, the number of syphilis cases has been increasing year by year, and in 2022, it finally surpassed 10,000 cases. Previously, most infections occurred among men through anal sex between men, but recently, the number of women infected has also increased. And it was said that syphilis was increasing as the number of foreign tourists grew, but even during the COVID-19 pandemic, syphilis has continued to increase year by year, quite significantly. Syphilis is an infectious disease needing caution. Can it spread through oral sex as well as sex? Can people have no symptoms when infected? What if your partner has it? If your partner has it, are you likely infected too? What tests are available? Is it easy to treat? Does it affect pregnancy or the fetus? I want to explain these clearly. Actually, syphilis is... Early on, there's little or no pain and mild or no symptoms, so if ignored, it may appear to resolve itself. This is also called latent infection. Even if you think you're fine because it seemed to get better, you could still pass it on to others. If left untreated, it can spread through the body and, in severe cases, affect the brain and nervous system, leading to meningitis or paralysis. It can also infect the cardiovascular system, which may be life-threatening. This video covers early syphilis symptoms and transmission, what infection routes exist, where to get tested, and available treatments. Men should also know that if a pregnant woman has syphilis, this video will explain the effects on the baby in such cases. Please watch until the end. At YouTube Medical University, we share important information and insights from a practicing doctor's perspective that aren't always covered in regular consultations. We try to explain things in a way that's easy to understand so that everyone can become a little healthier and stay interested in their health. Please subscribe to the channel so you don't miss any new videos. Now, here is today's table of contents. First, let's go over the symptoms of syphilis so you don't miss it in its early stages. Syphilis cases are rapidly increasing right now. We'll look at how this infection spreads, and once again, syphilis is on the rise. I'll also discuss if syphilis can spread through both regular and oral sex. Third, we'll discuss syphilis testing. Fourth, we'll review syphilis treatment options, including a single-dose treatment introduced in 2021. And finally, I'll explain about congenital syphilis and how syphilis in a pregnant woman can affect her baby. So, let's get started. First, let's discuss syphilis symptoms. As mentioned earlier, one problem with syphilis is its latent period when symptoms temporarily disappear. In other words, the progression of syphilis symptoms goes like this. Symptoms appear, then get better, then spread further, get better again, and then progress even more. It goes up and down like hills and valleys. The first peak is called primary syphilis, the second peak is called secondary syphilis, and the third peak is called tertiary syphilis. So what are the characteristics of each stage? From here, I'll be showing some images, so if you're eating, please skip ahead or pause the video for now. For example, syphilis can be spread through oral sex, and when it infects the throat, similar changes can appear. Here you can see redness inside the mouth and throat. In this way, you may experience a sore throat, mouth ulcers, and swelling of the lymph nodes around the face as initial symptoms. And when it infects the penis or female genitals, the penis may become red and develop sores. Some patients say it looks like a burn mark left by a cigarette. These kinds of changes can occur. It is also characteristic for the lymph nodes around the penis, such as those in the thighs, to become swollen. However, these swollen lymph nodes and skin sores are called ulcers, but these ulcers often do not cause pain. At this stage, some people may not feel any pain, have only mild symptoms, or even have no symptoms at all. So if this primary syphilis is left untreated and overlooked, there is a possibility that it will progress to secondary syphilis. Also, how much time passes after being infected with syphilis is important here. Actually, after being infected with syphilis, it's reported there's a long incubation period before symptoms appear. So after having sex with someone who has syphilis, you could go to the hospital immediately for testing, but still get a negative result. This is known as the window period. Early tests may not detect syphilis, but the infection will develop over time. And then you'll test positive. That can happen too. So how long is the incubation period? It's easy to remember with the number 3. Primary syphilis is said to occur within about 3 weeks after infection. And if you leave it untreated, you might think, oh, that's good, it seems to have gotten better. I wonder what that was. But actually, after about 3 months, the symptoms of secondary syphilis will start to develop. Here's a famous image showing the symptoms of secondary syphilis. Red rashes will appear. These small red rashes are called rose rash because they resemble roses. This rose rash can appear all over the body, but they typically show up in a specific area. That area is the palms of the hands and the feet. Diseases that cause bumps on the palms include syphilis, and also a disease that often spreads among children. That's hand, foot, and mouth disease. I think it's good to remember that both hand, foot, and mouth disease and syphilis tend to cause rashes on the palms. If you look at the left side of this image, you can see what looks like warts. This is called flat condyloma, and besides the rose rash, it is also characterized by the appearance of warts. Other features of secondary syphilis include systemic infection, so you may develop a fever or experience joint pain. And you may also develop symptoms such as swelling of lymph nodes throughout the body. These primary and secondary stages of syphilis are collectively referred to as early syphilis. Most people go to the hospital when these kinds of symptoms appear, but if the symptoms are mild or if they're too busy to go to the hospital, if left untreated, even secondary syphilis can temporarily improve on its own. Since you feel better and you're busy, you might skip the hospital, but if untreated, it can progress to tertiary syphilis, which develops over several years. We discussed 3 weeks and 3 months before, so I mentioned 3 years here on purpose. It develops over years, and by the tertiary stage causes systemic infection and affects tissues usually hard to infect, such as bones and skin. Little by little, rubbery lumps start to form. These are called gummas. If these gummas form in the nose, ulcers can develop in the nose, and when ulcers form, tissue is destroyed, so even as it heals, it keeps breaking down, causing nose deformity. Deep ulcers can also form on the skin and leave scars. Symptoms like these keep appearing. And as this tertiary syphilis continues to progress, it can move into what's called stage 4 syphilis, where it can infect the nerves or even large blood vessels like the aorta of the heart. Neurosyphilis is the most severe form of syphilis, causing meningitis that can result in fever and headaches. There's also something called tabes dorsalis, where the infection spreads to the spinal cord. Since the spinal cord is the pathway for the nerves that move our bodies, this can cause nerve problems and lead to paralysis. And it can also cause severe disorders like being unable to remember things, becoming confused, or experiencing symptoms similar to dementia. If the infection spreads to the heart or blood vessels, it can cause valvular disease. The heart's valves prevent blood from flowing backward, but if they get damaged, the blood in the heart can start to flow backward. There's also something called an aortic aneurysm. In our bodies, there's the aorta, which is the largest blood vessel connected to the heart, and this can develop a bulge. It can enlarge and swell, which can happen, and in severe cases, it may be life-threatening. You can see how frightening these symptoms are. Now, for the second point, I'd like to explain how exactly syphilis is transmitted. Actually, in the past, syphilis was more common among men. In other words, most cases were transmitted when male homosexuals had anal sex. Anal sex tends to cause injuries to the mucous membranes, which makes it easier for the infection to occur. Because of this characteristic, syphilis used to be seen only in men. However, that's not the case in recent years. As you can see from this graph, the number of syphilis cases among men is it's most common among men in their 20s to 40s, and among women, it's especially common in their 20s. In other words, it's being transmitted through heterosexual sex as well. And the scary thing about syphilis is that it can also be transmitted through oral sex, with infection occurring inside the mouth. So even if you think, I haven't done those kinds of things, so I'm probably fine, there's still a possibility you could be infected. Now, thirdly, I'll explain how syphilis testing is done. Since it's a sexually transmitted infection test, many people might think it involves collecting urine, examining the female genitals, or other embarrassing procedures, but actually, whether you have syphilis or not can be easily determined with a blood test. Of course, if you want to see where the syphilis infection is located, or if someone has syphilis, they might also have HIV, gonorrhea, chlamydia, or other sexually transmitted infections. Because the risk is high, sometimes a screening will include an examination of the penis or female genitals, but basically, syphilis testing can be done with a blood test. However, as I mentioned earlier when talking about symptoms, syphilis has an incubation period, so just because you tested once and weren't infected doesn't mean you're in the clear. If something changes after about 3 weeks, in that case, I recommend getting tested again at that stage. And as for syphilis testing or HIV testing, these are often offered for free at the public health centers in your prefecture, so please use a search engine to look up your local area plus public health center or area plus syphilis test. Depending on the municipality, you may find places where you can get tested for free and even anonymously to protect your privacy, so please check it out. Now, for the fourth point, I'll briefly explain the treatment for syphilis. Syphilis was actually an incurable disease in the past, but since the invention of penicillin, it has become a curable illness. So basically, the treatment for syphilis is to take antibiotics orally, or nowadays, you can also be treated with an injectable medicine that has recently become available. With oral antibiotics, you have to take the medicine for a certain period of time, but with the injectable medicine, actually just one intramuscular injection is enough to complete the treatment. Or so it's said. So for people who are too busy to take medicine for a long period of time, treatment is still possible, so consult your doctor. However, there is one thing to be careful about. With syphilis, symptoms may worsen briefly after starting treatment, which can make some stop their medication. However, you must not stop at this stage. This is rarely mentioned in other YouTube videos. It's also not on TV, so remember this. There's a reaction called the Jarisch-Herxheimer reaction, which is a bit of a mouthful. About 6 to 12 hours after you start taking antibiotics or begin treatment, you might develop a fever, your skin rash might get worse, your lymph nodes might swell, and you'll experience reactions that make it seem like your syphilis is getting worse. Even though you've taken the medicine, many people get worried because it feels like things are getting worse, but actually it's said that this is caused by the proteins from the syphilis bacteria, so in the end, it means the syphilis is breaking down and being treated. That's why it's important not to stop treatment here, but to make sure you complete the full course. If someone says, "I felt worse after taking the medicine, what should I do?" you can reply, "That's the Jarisch-Herxheimer reaction." It sounds cool, so remember the name. And when it comes to treating syphilis, there's something called ping pong infection, which means that even if you get treated once, there's a chance you could get it again. So it's very important to make sure your partner also gets tested and treated together with you. If you have it, your partner is likely infected too. There's a good chance of that happening, so if your partner doesn't get treated, you could end up getting infected again. Sometimes your partner's infection might actually be a latent infection. It can keep progressing and become a serious issue, so make sure your partner gets treated together with you. And what's getting attention now is something called premarital screening. Syphilis and HIV often don't show any symptoms. There's a trend encouraging couples to get tested for syphilis and HIV before marriage, even without specific concerns. I think it's wise to actively consider testing together. Alright, this is getting a bit long, so finally, please make sure you know about congenital syphilis. Congenital syphilis is when a baby gets syphilis from their mother. If a mother who is infected with syphilis becomes pregnant, there is a possibility that the baby could get infected as well. This is called congenital syphilis, and as for how it affects the baby, one major thing is that it can cause infertility. It is also said to increase the risk of premature birth or stillbirth. When someone struggles with infertility, we usually first screen for sexually transmitted infections. And in addition, if the baby is born infected with syphilis, their life can be at risk. This is called congenital syphilis. When a baby is born infected with syphilis, their skin may be ulcerated, or organs like the liver and spleen may become swollen, leading to such complications. Since this can pose serious risks to the baby, it's really important to be aware of congenital syphilis and for everyone to know about it. Basically, if you go to the hospital and get treated early after finding out you're pregnant, there's a high chance that congenital syphilis can be prevented. And at obstetrics and gynecology clinics, syphilis testing is routinely done, so as long as you go to the OB/GYN when you think you might be pregnant and get the usual tests, syphilis will be screened for, so please don't worry. On the other hand, if you are pregnant but can't get to the hospital right away and your first visit is delayed, in that case, the risk of congenital syphilis will keep increasing. So of course, if you find out you're pregnant, please try to visit the OB/GYN as soon as possible. So how was that? This time, I discussed syphilis symptoms, transmission, testing, treatment, and congenital syphilis. Syphilis has primary, secondary, and tertiary stages, plus a latent period that makes it problematic. It's transmitted through vaginal, oral, and anal sex, so caution is needed. It's important to get treated with your partner. Injectable medications are now available. You can get free testing at local public health centers, so check that too. And to prevent spreading syphilis to newborn babies, it's essential to get tested for STDs and to visit an obstetrician regularly if you become pregnant. And in 2022, the number of syphilis cases finally exceeded 10,000, and it's a disease that's rapidly increasing right now. I really want to share the content of today's video with the younger generation, even if just a little, so please share this video with your family and those around you, and if you could hit the like button, it will help this video reach more people. So I would really appreciate your cooperation. I share key information on diseases and prevention to help you stay healthy, so subscribe to the channel to catch future videos. If you have questions or requests about this video, and if you have any information like symptoms you've experienced or places where you can get tested, please leave a comment. Well then, I'll see you in the next video.